Hello and welcome to India Top Doctor. Today we are back with another episode of the Health Dialogue, and our guest for the day is Mr. Nilesh Chordiya. Today we will talk about esophagus cancer. As the number of cancer patients in India has increased by about 10% in the last 4 years. According to the National Cancer Registry Program Report 2020, there are currently 14 lakh cancer cases in the country. It is estimated that by 2025, this figure may reach 16 lakh. There are many types of cancer, but in today's time, most people in India are affected by the cancer in the food pipe, which is also called esophagus cancer. To understand more on this, please welcome Dr. Nilesh Chordiya. Then, sir, welcome to India Top Doctors Health Dialogue. Today we will talk about esophagus cancer. So before we start, can you tell us what is esophagus cancer?
Okay. So basically, esophagus is also called as a food pipe. It's a part between the throat and the stomach. So it connects the throat with stomach, part of the food pipe, and it is divided into three parts according to our scopy reports: upper, middle, and lower third. I will discuss you why we divide it later on.
Okay, then. There are many questions in some people's mind that esophagus cancer is a genetic disease. Is it true?
Esophagus cancer, only 10% patients are familiar genetic. Most of them are sporadic, and because of some habits, they have various habits like smoking, alcohol, which are the most common habits. Some people drink excessive hot liquids. They also causes esophagus cancer. Some have reflux, Barrett's esophagitis. So chronic gastric problem, gastritis problem, acidity problem with reflux, it can cause C esophagus. Sometimes some chemicals are also there which causes esophagus. So hardly 10% are genetic, maximum are sporadic.
Can you tell our viewers some of the common symptoms of esophageal cancer so that they can visit the doctor at the right time?
Right. So basically, esophagus cancer, they have most common symptom is difficulty in swallowing. This lumen, there is something occluding that lumen. It is blocking the path, so they are not able to swallow properly, and that's why initially they have difficulty in swallowing for solids, but gradually it progresses to liquid also. And in advanced stages, we have seen patients who are not able to swallow their saliva also, because lumen is completely blocked. So difficulty in swallowing the most common and most persistent symptom. Second is some patients have difficult, painful swallowing. They have little pain in throat after swallowing because they are not able to push the food completely into the stomach, and that's why the remaining fluid causes these disturbances to them. Locally advanced tumor, they have backache as a persistent symptom. Backache and weight loss. More than 10% weight loss in few months is really dangerous. You need to be cautious about this thing. And very few patients, they present with change in voice because the nerve which supplies our larynx voice box, it traverses just parallel to esophagus. And if it is involved by any means, then they have hoarseness of voice, change in voice. It is also another common symptom. So to summarize, difficulty in swallowing, most common symptom. Weight loss is second most common. Third is backache, and fourth is difficult change in voice. So these are according to severity.
So I'm sure this will aware to somewhat to our people and our viewers, I guess. So you were telling me about the different types of and different kinds of esophageal cancer. Can you tell us about that?
Yeah. So basically, esophagus cancer, we divided them as per our treatment plan into upper third, mid third, and lower third. They are also divided into by histology into squamous carcinoma and adenocarcinoma. So basically, upper third and mid third, they are mostly squamous carcinoma. The lower third, they are generally adenocarcinoma. The causes of both are different. For example, smoking is most common cause of squamous carcinoma, while alcoholism and reflux gastritis, that is cause of adenocarcinoma. So why we divide it? Because our treatment plan changes completely depending upon the location. In upper part, we'll just discuss in the flow later on, but our treatment plan changes drastically with this thing, and that's why we divide them into upper, middle, lower, third, and also squamous and adeno, because squamous carcinoma treatment is slightly changed, adenocarcinoma treatment is slightly changed.
Can you tell us what is the most dangerous kind among these?
What is the most dangerous kind of?
Dangerous kind.
Both are dangerous. Esophagus cancer is a dangerous thing. They have mostly the patient present in little advanced stages, and that's why they have little poor prognosis. Squamous carcinoma are slightly more aggressive than adenocarcinoma, if you see etiology wise.
Okay, so who is at the more higher risk of getting esophageal cancer? If you can talk about that.
So I told you about the causes. The squamous carcinoma, the smoking is the most common cause of esophagus cancer. Many people who are smoking for long duration, if they quit smoking, their chances of developing squamous carcinoma decreases gradually, but their chances of developing adenocarcinoma remains same throughout life. That's why you should never smoke. You should never start smoking. That is the important thing. Second most important cause is alcoholism. Alcoholism is causes lower esophagus cancer mainly. They are adenocarcinomas. The third most common is some viruses are there, HPV viruses there. It is also a causative factor for esophagus cancers, mostly squamous carcinomas. Then some people, they have a habit of drinking very hot liquids to the tune of 40, 50, 60, 60 degrees Celsius. So these harmful to your esophagus mucosa, and it can again cause cancer. Certain chemicals are known to cause cancer, like phenyl, what we use in our day-to-day cleaning and this thing. So this phenyl contains chemical which can lead to chemical burn, and it can cause carcinoma, esophagus carcinoma in people. There are other genetic factors like tylosis. Tylosis is basically a genetic disease where they have thickened skin of their palm and sole, and then they have more tendency to develop esophagus cancer. There is another hereditary disease called hereditary Barrett's esophagus. So these patients have the reflex of stomach juice in their esophagus, and stomach juice is generally acidic, and esophagus solutions the secretions are alkaline. So this reflux causes injury to their esophagus lower tract, and they cause adenocarcinomas. So any reflux, chronic reflux, it can be a causative factor for adenocarcinoma of esophagus. So these are the most important causes which we come to in day-to-day practice.
All right, so we talked about all the causes and all the symptoms of it, but we don't want to scare our audience too much. Let's talk about some preventions and treatments. So can you tell us how do we beat esophagus cancer?
Yeah. So basically, the most important factor to beat esophagus cancer is, I have told you, avoid smoking. But taking smoking and quitting, it is partly useful, but if you don't start, that is the most important thing. Second is alcoholism. So it is shown in various studies that in males it is around 2 peg and females 1 peg. That's the maximum they should consume in a week. If they are consuming daily, they are more prone to develop esophagus cancer. Then third is this phenyl I told you, many people consume as a suicide this thing. So it should be kept at a separate place. It should not be accessible to the person who is little fragile by nature. That is one thing. And the chronic reflux is there, it should be treated immediately. Any patient who is having reflux for more than 3 weeks, they should consult gastroenterologist. They should take some medicines to prevent reflux. Sometimes some procedures are also there which can decrease the acid secretion. So they should undergo those things because it can prevent developing a cancer. So these are the most common factors, and there are unknown factors like some vitamin C is there, diet high in fruits is there, diet high in vegetables, it has a protective effect on developing this cancer. So you should you consume them regularly, less of non-veg, more of vegetarian food. That I will say, tell you, it is helpful to your this thing esophagus. So it maintains normal metabolism and it causes decrease in the esophagus cancer. Obesity is one of the risk factor for esophagus cancer. So because obesity patient they develop more of a reflux problem. So keeping your weight under control is another important thing. Actually, obesity is causative factor for almost 19 cancers in our body. So when you keep healthy weight, you can prevent almost 19 cancers in your body. And that's why what we tell is whatever your height is there in centimeter, minus 100 should be your ideal body weight. Means if your height is 150 centimeter, 5 feet, 150 centimeter, minus it is 50 centimeter, it should be your ideal weight, plus minus 5. If it is higher, then your chances of developing the disease increases drastically.
Okay, so can you tell us
For prevention, yeah.
about your ideal diet? What can be an ideal diet for our viewers?
So basically, ideal diet, what we call it should be multicolored. It should be have all the colors. Some part should be red, some part should be yellow, like some part should be red, like tomato, the carrots, or some beet or something. It should be red. Some part should be yellow, some part should be green, some part should be white. Multicolor diet is most important thing. It indirectly means you should consume variety of foods with some fruits in your diet. Multigrain are important. Single grain only gehu, it is slightly harmful to your body. But if you are using multigrain, your chances of cancer automatically decreases. And fortunately, our ancient people have already knew this all the facts. That's why if you see Indian diet, it has always have uh, multiple grains in it. They have some masalas used which are used which have anti-cancer effect. Actually, you will be surprised to see the curcumin, haldi, what you use. It has large anti-cancer properties. Then piperine is there. It also has a large anti-cancer properties. So cereals are there. So if they are consumed regularly, our ancient people used to always include them in as a masala in various subjis and this thing. So if it is indirectly going to your food, it automatically decreases your chances of developing any malignancy. And sometimes the other disease also like BP, blood pressure, diabetes, these chances also decrease if you are consuming this all multigrain diet high in vegetables, diet high in fruit, and less of processed meat. Basically, you can consume non-veg, but processed foods are really harmful. So any processed red meat, some aerated drinks, they are always harmful to your body. Should try to consume them at a minimum. There is second important factor I would like to tell you about diet. Basically, many people, Jain people, basically they follow this after sunrise they start eating, and after sunset they don't eat. So basically, it is a 12-hour gap. The same concept is with Dikshit diet or with other diet thing. So they keep a gap of almost 12 hours in your two meals. And why it is important? Because many chemicals like pesticides, even if you are eating vegetables, but many pesticides they enter your body, and your body has a capacity to eliminate them, to throw them through either liver or through kidney, urine. So if you give adequate time for your body to wear off this, all these chemicals, then your chances of developing malignancy decreases. And that is the sole concept behind what you call Dikshit diet or Jain diet or whatever you call it. But 12 hours fasting a gap should be there in your two feeds, night feed and morning feed. If 12 hours gap is there, your chances of developing cancer decreases drastically by almost 50 to 60%. And that's why we see in Jain sadhus, we see they hardly develop cancer because they follow these rituals.
That is a very useful tips you gave us. Many people have this doubt that esophageal cancer, can it be treated by chemotherapy, and can you diagnose the cancer?
Esophagus cancer chemotherapy has a role in downstaging the disease. Esophagus cancer is never cured by chemotherapy. Squamous cancer, if you say, they are cured with another therapy called radiation therapy. So either surgery or radiation therapy, both options are there for squamous carcinoma as a curative thing. But as a downstaging thing, you can use radiation also, you can use chemotherapy also. What we follow in our practice is, because radiation also has curative effect, but they have more side effects as compared to surgery. They have chronic burning sensation in their throat because it is a kind of burning your tissues inside. So that's why they have long-term problems, and the cure rate is less. Means almost 80 to 84% patients are cured with radiation therapy alone, but same patient subjected to surgery, the chance of cure is almost 94%. That's why surgery is always preferred over chemotherapy or chemo radiation therapy. Only thing is patients who are medically unfit to undergo surgery, because this surgery is slightly extensive surgery. And if patients are medically unfit, like they have asthma, severe asthma, they have age more than 75, 80 years, they have long medical problems which cannot be controlled easily. In those patients, then we advise radiation therapy as a curative treatment. So chemotherapy is only for downstaging disease to make it more suitable for surgery.
Okay, sir. That was very useful. I won't take much time of you now. Just one last question. As a frontline worker, how do you follow the COVID protocols and how are you maintaining the whole situation in
Uh,
with you and with your family both?
yeah. Basically, that I will tell you. Yes, we. So esophagus cancer therapy treatment wise, I told you that upper third, lower third. Why we divide it? Because upper third cancer, they have there we generally give chemoradiation as a curative treatment, because if we want to remove upper part, we have to remove the voice box also, and then they will lose their voice, and that's why chemoradiation is preferred in that area. Mid and lower third cancer, esophagus cancer, the treatment is mainly, if they are very early stage, we offer them surgery. If medically unfit, we offer them radiation therapy. The most important is if they are locally advanced, then we offer them some therapy prior to surgery. It is called neoadjuvant therapy. Neo means prior to main therapy. So generally, the preferred therapy is chemo plus radiation therapy, which is has little advantages over just plain chemotherapy. So chemoradiation is 5 weeks course, and after 1 week, 1 month of this completion of chemoradiation, we operate them. Uh, and chemotherapy is once in 3 week course is there. So one day, then after 3 weeks we repeat the dose, and after third we operate them. Surgery also has drastically changed in esophagus cancer. Yeah, if you see around 5, 10 years back, the main surgery was open surgery, where they used to give a long cut and then they remove the esophagus, then they make to use a stomach tube and join it. So it has a very painful course, and they lot of them had a lot of uh, lung complications. We need to keep them on ventilator postoperatively, and then they had pneumonitis, and even those patients have high mortality rate also. To the tune, esophagus cancer, it was said that almost 5 to 10% patients die because of surgery. But now the scenario is completely changed. Now we are completely shifted to a laparoscopic surgery. Laparoscopic surgery has many advantages. The main advantage is we never require to put them on ventilator, because the recovery is very good. They generally after surgery, there is small holes are there, 5 millimeter holes are there, 3 holes are there. So in that sense, pain is very low. That's why their lung complications are rare. Their ventilator requirement almost nil. Their hospital stay is less. On 5, 6 days, we can send them home. That's why, and fortunately, I done around 200 esophagus cancers in the in last 5, 6 years. So we hardly had 1 or 2 patients who died after surgery because of other complications. One patient had COVID, and that's why he is sick, and other patient has some lung infection. but the rate had drastically reduced from to 1 to 2% as compared to 5 to 10% in the open surgery era. So treatment has drastically changed. Laparoscopy surgery has now become a gold standard, and most of the patients they recover very well and they do very well after surgery also. And now you can come to your
Thank
COVID.
you, sir, for covering that part actually.
Thank you.
If we
Thank you.
missed that, it would not have been good.
Right, right.
Now, can you tell us about the COVID protocols you have been following?
Yeah. So now, if you see, the first wave came, second wave came, and now many more waves. Experts say that they might be coming. But what is common is your hand sanitization, your hygiene protocol. They are most important, and wearing mask. It has shown to have substantial effect on preventing the COVID. So if one person is wearing mask, it decreases chances of getting infection by almost 50 to 60%. And if both patients are wearing mask, the positive patient, negative patient, it comes down to 96 to 97% protection rate is there. And that's why everybody should wear mask when they are going out. Second important thing is hand hygiene. Always wash your hands. Because and third important thing is now vaccine is available and it has shown good results. At least it has shown decrease the mortality. The third wave, if you what we are seeing, the chances of getting infection are still there, but they have very less chances of dying from cancer, from the Omicron or the COVID as compared to first or second wave, because this vaccine is giving us protective effect, and that's why everybody should take vaccine. Now, fortunately, government has announced booster dose also. So whatever whoever patients are there, they don't be don't afraid. Just take the vaccine. You will be safe. And what we say is booster. If you are who are healthcare workers, it now open for them also for them. But whoever person who are not taken dosage vaccination, please take it. It is the thing which can save you from the death of the esophagus. Some untoward, some deaths are reported even with vaccinated people, but they were high risk. They were having high uncontrolled diabetes. They were having uncontrolled hypertension. So these are the few patients we can, which had problem, but we can neglect them. But if you see 99% patients, they are safe with vaccine, and that's why everybody should take vaccine. A lot of my cancer patients ask me whether they can take vaccine or not, because somebody has told in their mind that if you are a cancer patient, you should not take vaccine. So it is a myth completely. What I would like to tell you, only if you are on chemotherapy, in that duration, you should not take vaccine. But once your treatment is over or you are prior to starting chemotherapy, you should complete your vaccination. That is important thing I would like to highlight to all the cancer patients in this year.
Thank you so much, sir, for such useful. I'm sorry,
No, these are
you
my
were
use
saying.
for my cancer patients. But please take vaccine and don't be afraid. If anybody telling you that you don't cancer patients should not take vaccine, it is a myth. They should take vaccine.
Thank you,
Thank,
sir. It was a wonderful session. Thank you, sir.
thank you so much. Thank you. Nice talking.
And if you guys want to take an appointment of Dr. Nilesh Chordiya, you guys can do it by visiting Dr. India Top Doctor's website. For more such videos, keep watching India Top Doctor.